I'm Debbie Statler, Editor-in-Chief of Provider Magazine. I'm here today with Ben Hawkins, Director of Public Affairs for the Maine Health Care Association. Thanks for spending some time with us.
Good to be here.
Well, let's start at the beginning. How did you come to be involved in long-term care?
Well, I think my story started a lot like many with my grandparents. I saw the care that they got at first an assisted living facility and then a nursing home, and the staff there that cared, and how much value they added to their last few years of life. I know other family members of mine where they weren't able to go to a nursing home, and how much stress that caused for the family members who had the care and had to take time off of work and everything. So when I was a child, seeing my grandparents get all that assistance was my first foray into long-term care, and that really stuck with me.
I agree with you. I think that family connection really has spurred a lot of people into a career in long-term care. Well, switching topics, what are the top legislative and regulatory priorities right now in Maine for long-term care?
It's not that different from the rest of the country, I'd say. Medicaid funding, or we call it Maine Care in Maine, being one priority, and then another one is workforce. That's a big issue. Maine is especially hit with that. Maine's the oldest country oldest state in the country by median age of its residents, and so there's a lot of people who need long-term care, and there's not a lot of young people who are in the workforce.
Well, tell me about some of your recent success stories with advocacy.
A recent success story with advocacy would be a bill that we introduced in the current legislative session in the state with agency staffing. That's been a real landscape changer for Maine, and it's hit facilities really hard. A lot of facilities are using agency staffing because that's the only option available, and the costs associated with that are unsustainable. So we worked with stakeholders, including the Maine Hospital Association, on developing a bill that would get a lot of data tracked in terms of the costs and what the profit margins are for these staffing agencies, and for the legislators to know more about this issue. It was very clear during the hearing that for a lot of members on that committee, they really didn't fully understand how big the costs have jumped in just a few years. So we had nursing facility administrators and staff reach out to those legislators. We had over 300 messages sent to elected officials, which is a lot for Maine. And that bill's still going well. It just passed the committee process, and we're hoping it'll get a good vote in the full chambers.
It's amazing how much the communication and really telling more about the issue, increasing knowledge for the legislators really makes a huge difference. Well, you mentioned workforce. Obviously, that's a hugely challenging issue, and there are other pieces of the business climate that are still quite challenging. I know several facilities have closed. How is this playing out in Maine?
So since 2020, we've had about 15 facility closures, and then one is just wrapping up, so it'll be 16 facilities very shortly. So we have 88 facilities in total in Maine. And that is quite a change. We used to have in the 90s over 10,000 nursing facility beds. Now we're getting below 6,500. And as I said earlier, Maine is the oldest state, and it's getting older. So there's a lot more people who need this care, but we're losing those beds, and they're really hard to bring back once they're gone.
Well, those are some staggering numbers, goodness. Well, how do we get folks involved? What advice do you have for providers in Maine if they want to help the cause and tell their story to legislators?
Well, first off, the Maine Health Care Association is here to help. We have resources, we've got a toolkit for grassroots advocacy, and we're always happy to talk on the phone or email to get the ball rolling. And another thing I like to really get across is when it comes to advocacy, it's probably a lot easier than you think. You might have some real fears about talking with an elected official or testifying, but really if you've had a conversation before, it's no different. If you've made a phone call before, calling your elected official is really no different. And in fact, they want to have those conversations. Our staff at our nursing facilities, they're doing a lot of hard work, and they know what we need, what they need to provide the best care. And so the elected officials really count on that to get that information to them so they can make the best decisions at the State House.
It really is important to make those connections and build those relationships. Well, thank you for spending some time with us today, Ben. I appreciate it.
Yeah, thank you so much.